I'm going to look at your chest and listen to your heart. Is that all right?
It's fine by me.
I should have left this on. Okay. So, chest looks good, but I'm just going to listen to your heart, okay? Now, I'm going to listen to your... I'm so sorry.
Sorry.
Okay. And your pulmonary valve, where S2 is heard the best. Great. Herbs point. And your tricuspid valve, where S1 is heard the best, and your mitral valve. Super. So, I am going to check your fingers for capillary refill, okay? I'm just going to be squeezing you a little bit. Perfect. 2 seconds. That is good. And now, if it's okay, your chest wall looks normal and with no abnormal pulsations, heaves, lifts, bulges, murmurs, masses, no tracheal deviation, no JVD, everything looks really good. I am going to listen to your lungs now, if that's okay. All right. Can I just move this?
Yeah.
Deep breath in. Again, deep breath in. Great. Deep breath. Deep breath. Awesome. And listen on the side here. Deep breath. Over here. Let me just do that again.
Okay.
Deep breath. Okay. Deep breath. Deep breath. Great. Now listen over here. Deep breath in. Deep breath. Deep breath. And one more on this side. Okay, great. I'm going to go around to your back now. All right. All right. Deep breath in. 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 Again. Again. One more time. And last one. Okay, that sounds great. And now I'm going to feel your chest. Can you take a deep breath? Okay, awesome. You have full symmetric thoracic expansion with bilateral symmetric fremitus. You are clear on auscultation bilaterally. And now I am going to look at your belly, so I'm going to have you lay back down, okay? Thank you. I'm going to inspect first There is no abnormal vasculature. There are no anything. I'm gonna lay you down flat. Is that okay?
Yeah.
Okay. Your abdomen appears flat. Maybe there is someone who could give me a pen light. Thank you. I'm just gonna shine this light on you and look, okay? Good. Let me just see. Great. Even contour, uniform contour. Your skin color is appropriate to your ethnicity. Your stomach is flat and symmetric with no visible vascular patterns. Now I'm just gonna listen, okay? All right. Normo active bowel sounds. Normal active bowel sounds. Normal active bowel sounds. Normal active bowel sounds. Okay, now I'm just going to feel your abdomen, okay? Be gentle. Okay. Any pain or tenderness here? Pain or tenderness? Pain or tenderness?
No.
How about here?
Ouch.
Okay,
Yeah.
so that's a little tender. Tenderness there. No rigidity or bulges. Okay. When was your last bowel movement?
This morning.
Okay, was it normal for you? Was there any blood or mucus?
Normal. No blood or mucus.
Okay, soft and formed?
Yeah.
Do you use any laxatives?
No.
How about your urine? Is it normal?
Pretty
smelly,
normal.
Clear?
Clear.
Not painful
No,
to urinate? Okay, great. Now I am going to check your legs for edema. Your legs and your feet. They look great. It looks to be a 0 grade edema. I'm going to check capillary refill on your toes, so I'm just going to pinch you a little, okay?
Okay.
That's great. That's a 2, same as your upper extremities. And now I am going to check the pulses on your feet, all right? All right, you ready? This one. Okay, and this one. Okay, great. All right, do you have any questions for me?
No.
All right, I'm going to get all this information to your provider, okay? I'm going to sit you up a little bit so you'll be more comfortable until then. All right, now I'm going to be listening to the renal arteries. Alright, now that I've identified all the pulsations, I can move on to my bell. With the bell, I don't want to press very hard because then I'll just make that a diaphragm.
Alright. With that, I didn't hear any irregular heart rhythms. I heard the S1, which is also known as the love dub. So, no abnormalities noted. And I heard that with all your aortic, iliac, and renal arteries. So now I'm going to start percussing. Let me know if you feel any tenderness with this or pain or if something doesn't feel right to you. So with this, I'm going to be tapping on my middle finger and listening for tympany. Tympany would be that's on a hollow organ or known as an air-filled organ, so like the stomach. And then you have your solid organs, which are going to be like your liver, your pancreas, and those are going to be dull sounds. So I'm just going to be tapping around. That was your stomach, and I did hear that tympany. Okay. So now I'm going to be doing percussing your liver in specific. I am going to be measuring this in centimeters. Normal parameters for this liver margin test is between 6 to 12 centimeters. So what I'm going to do is I'm going to start percussing here, and once I hear dullness, I'll mark that area with my pen, and then I'll keep going, and once I hear the dullness leaves, then I will mark my pen there, measure that. So let's start down here. Just gonna make a small little mark there. So I have 8.5 centimeters, so that is within normal parameters of the liver. Hepatomegaly would be an enlarged liver, so this is something that we could identify with this test, and then we need further testing to guarantee that, but that was not abnormal. So are you able to sit up for me?
How much do you want me to sit?
Just 90 degrees, bending up the hips. So with this, I'm going to place my palm underneath your costovertebral angle, and I'm going to put my 4 fingers on each kidney, and I'm going to strike my hand. You tell me if there's any kidney tenderness. So, and I am going to move this up just a little tad bit. Yep. So close to you. Did you feel any tenderness?
No. No.
Put that back. Have you lay back. Alright, then I'm gonna just do some palpation. Tell me if this hurts at all, or you kind of feel some uneasiness with that.
Mm-hmm.
So I'm just gonna do light rolling circular motion, feeling for anything that would concern me for further clarification of what it was. Alright, I didn't feel any hard knots, no, I was easily palpable, so I didn't feel any distension in the abdomen. And then lastly, there is a deep palpation, which is going to be for the liver, the kidneys, and the spleen, but those are things that we as nurses shouldn't do because of the risk risk associated with it. And I forgot the aorta. So with the aorta, what you would want to do, it's about 2.5 to 4 centimeters wide. And it runs right about right here where we're doing the palpation, listening for it, auscultation. So with that, you want to use your opposing thumb and finger of the forehands, and you're just going to be feeling around for it. But with this, if there's like an abdominal aneurysm, aortic aneurysm, you wouldn't want to do that because you could cause it to rupture. So, and then with the kidney, you would test the right kidney with the duckbill method. So you'd make a duckbill with your hands and you'd just be feeling on the bottom for the kidney. But again, only the doctor should really be doing that. For the spleen, you have you're gonna reach your left hand under the spleen, this rib cage right here, and you're gonna be palpating. If you felt the spleen, that would be a stopping point because that would indicate some enlargement of the spleen, and we don't want to cause that to rupture. And then with the liver, we can use a hook method and feel under that, and we wouldn't want to do that either because of the bleeding that could be associated with the hepatic portal vein. So, do you have any questions for me, Allison?
No, I don't.
All right, thank you for your time today.
Yeah.
To open and close your mouth, and you let me know if you have any pain, but I'm just checking to see. Open and close. Okay, can you bite down, like clench your teeth? Very good. All right. All right, can you smile? Okay. All right, very good. Okay, can you smile for me? Can you frown? Can you raise your eyebrows? Lower your eyebrows? Can you lower your eyebrows and smile? Okay, very good. All right, I'm going to whisper something in your ear and then you're gonna tell me out loud what I said, okay?
Okay. Yankees are awesome. Giants have a winning record.
Okay, very good. So that was a test of your acoustic nerves, and that's exactly what I said. Okay, so right now I'm gonna ask you to close your eyes and open your mouth, and we're gonna test your sensation of taste, like your taste buds. So I'm gonna put something either salty or sweet, and after I give it to you, you tell me if it was salty or sweet.
Okay.
Okay, close your eyes.
Salty.
Can you tell me what it was?
Pretzel.
Okay. I'll wait till you finish.
Mm-hmm.
Okay. Okay. Ready?
Mm-hmm.
Okay, close your eyes.
Now I'm ready.
Are you ready? Close your eyes.
Gummy bear, sweet.
Sweet. Good job. Okay, after you're done with that, I'm going to ask you to open your mouth and say ah. Okay, again. Okay, the soft palate was innervated and rose, and your uvula rose also, and it's also midline, so it's very good. So it's positive reaction. Okay, so now this is unpleasant, but I have to check your gag recess, so I'm gonna need you to open it. I know. I need you to open your mouth and say ah. All right, and we'll just. I'm sorry, I know it's unpleasant, but we have to do it, okay? Okay. You gagged. Yes. Okay, all right, very good. Okay, I'm going to touch your face again, and I'm gonna ask you to resist against me pushing against your face. We're gonna do it on both sides, okay? Mm-hmm. So push, like try to turn your head. Okay. Okay, very strong. Okay, very good. I'm going to do the same thing for your shoulders and just try to resist me. Try to push your shoulders up. Okay, very good. All right, now I'm gonna check your hypoglossal nerves. If you can stick out your tongue for me. Okay, can you move it side to side? All right, can you put your tongue in your mouth? And I'm gonna ask you to push against your cheek and against my hand, okay? So push against my hand with your tongue. Okay, other side. Okay, very good. Okay, now I'm going to test your fine motor skills. So I'm gonna ask you to do a couple of things, but I want you to repeat them very quickly. So the first one is I'm gonna ask you to smack your knees or your thighs, but you're gonna flip your hands over back and forth quickly, okay? Can you do it faster? Okay, very good. Okay, now I'm gonna ask you to touch your finger with your thumb, each finger alternating, okay? And then the other side. Okay, now I'm going to ask you to touch you're gonna touch your nose and then you're gonna touch my finger and I'm gonna move my finger around. Does that make sense?
Okay, I think so.
Okay, so you touch your nose and then my finger. But try to do it fast, okay?
Oh, okay.
Okay.
Alright.
Okay, go ahead. Okay. All right. Okay, very good, very good. All right, now, okay, I'm gonna move this chair out of the way and I'm gonna ask you to walk straight about 5 paces and then turn back and put one foot in front of the other.
Okay.
Okay, so we can stand up. Okay.
So just walk normal?
Just walk normally. Okay, patient's gait is steady, balanced, not uneven, and then now 1 foot in front of the other. Okay, do you feel dizzy at all or off balance? Have you ever had a stroke?
No.
Okay. All right, oh sorry, I need you to stand still. That's okay. This is the Romber Test. I'm gonna ask you to close your eyes for 20 seconds and we're just testing your balance and your orientation, how you are when your eyes are closed and feet together, please. Okay, we'll count to 20 seconds. Keep your eyes closed. 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Very good. Have a seat, sir. All right. Sorry, excuse me. Okay, now we're gonna test your sensory perception. So I'm gonna touch you with, your eyes will be closed and I'll touch you with something soft. And wherever I touch you, I'm gonna touch you from head to toe. If you can roll up your sleeves for me a little bit and you just say now when you feel that I've touched you. Okay, so but you have to have your eyes closed. Okay.
No. 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 No.
Okay.